Everybody's there. Ready to go.
Peter McEntee.
We popped in.
Yeah, must be Pete McEntee. I think might be people still calling in on the phone.
It doesn't matter. They'll come up on the laptop.
It will?
Yeah.
Okay.
We start audio. We just Zooms we use 656. We don't use phones. You'll see the little icon. You see a little PCI. You'll see the icon of a phone. Hi, who are you? You're there. That kind of. The same way you did it last time. Nothing changed.
Okay. Ernie's in.
You hear me?
I hear you, Ernie.
You hear me okay?
Yep.
Okay, good.
I think Pete McEntee is on, but he's at the bottom of the list. So.
Yes, Glenn.
Yeah.
Hi, it's Peter. How are you?
Good, Pete. How's it going?
Good. Yeah. So I had a meeting with Dennis Conservation that has now been, we're completed with that. So, but I'm here, and whenever you're ready, I'm ready to go.
Okay.
Okay.
You're on the bottom of the agenda, but we'll see how that goes.
Yeah, no problem. Yeah, whatever. I'm here.
Hang on.
Get a wicked echo.
Yeah, it's because it was testing.
Cool.
All right. Julie. Go downstairs.
Who is 737-4768? Okay, Mr. Chaudhry is here.
Muted.
They're muted, right? I didn't mute them.
You can't be grouped until.
Glenn, that's Peter from 737-4768.
Oh, okay.
Yep.
Oh, that's
Oh,
the audio.
okay.
Somebody was
Yeah.
with the laptop.
Yeah. Okay, cool.
All right.
I thought I recognized the number, just wasn't sure.
Okay.
All right, David left the room. I can take my mask off. And Ronnie should be calling in any minute here.
Okay.
Brian, were you able to see my comments?
Not yet. I'm just
Okay.
pulling those up. How you doing, Glenn?
Good, Ernie, how are you?
Good, good. Hanging in there.
That's good.
Yeah. How are you, Brian? I'm good. I'm good. How are you? Good, good. Well, busier than I like to be. I hear you. Can't go to Florida and play golf, so might as well work.
Yeah.
Hi, Said.
Hello, Glenn, how are you? Hello, Arnie, how are you?
Hey, what's up, buddy?
Nothing much, how are you?
Hey.
Time, Arnie, I haven't seen you. I've been talking to Mary on and off, but never,
Yeah, long time here, pal.
maybe 10 years, more than 10 years. I didn't
Oh, I
know.
bet you that long, for sure.
How's family, everybody's okay?
Yes, everyone's fine. Thank you very much. How about you?
Good, good,
Very good?
yes.
Oh, hey, Brian. I remembered that Ronnie is actually tied up for a little bit. She may join us later. But
Okay.
she was gonna miss probably the first portion of the meeting.
Okay.
Actually, I don't know how much. She just said that she was detained and would not be at the meeting. So she said she would pop in if she could, so.
Oh, okay. I got you. All
So
right.
she's babysitting, and so that may be short and it may be long, so I probably shouldn't say how long that should be. She wasn't
Okay.
she wasn't sure herself.
Okay. Well, that sounds fine. I think then why don't we get started? Since it's 7:01 p.m., we'll bring the Mashpee Board of Health to order. Our first item of business this evening is a review and approval of the meeting minutes from December 17th, 2020. Does anybody have any comments or changes for that set of minutes?
I made my comments.
Okay. Yeah, I think I was good on that set.
I'm good.
Okay.
Want me to make a motion?
Sure.
Yeah, I'll make a motion that we accept the minutes of the. Wait a minute, can't find the date here.
December 17th.
Right, here we go. Accept the minutes of December.
Okay, I will second that motion. All those in favor?
Aye.
Aye.
I'd like to ask the board to add the December 3rd minutes. They were completed and sent to you. They just did not make it onto the agenda, but they are complete.
Oh, okay. Where did those? Oh, there they are. They came through today.
Okay. Yeah, I'll make a motion, we accept it. I don't have a problem. December 3rd. Accept the meeting minutes of December 3rd.
Okay. I will second that motion. All those in favor?
Aye.
Aye.
That was to add
Very
them to the agenda, correct?
Yes, yes. And then a motion to approve those minutes?
I'll make a motion, we approve those minutes.
Okay. I will second that motion. All those in favor?
Aye.
Aye.
Okay, thank you.
You're welcome, Glenn. Thank you. Let's see, a review and approval of expense warrants. I know I haven't made it down to town hall to sign anything. Do you have some sitting waiting for us?
Yes.
Okay.
You need me to come down and sign? Good.
I don't have them with me. Ernie, let me check. I think you may have signed them.
Okay. Yeah, I
I
think
gotta
I
head up
did.
to George. I gotta go up to George O'Brien's plumbing tomorrow anyway, so I'll try to swing by when I head up there.
Okay.
Okay, let's jump to review of compliance for Michael Escher, 83 Troon Way. Glenn, if you could give us the background information, please.
A violation letter was sent to Mr. Esker that outlined conditions of the violation that occurred on 83 Troon Way. The board should have received a copy of the violation letter. The hearing for this violation was to be held at the last Board of Health public meeting, but the hearing was continued to this meeting tonight at my request. Mr. Esker and his company had suffered a loss of a coworker, and they were attending a wake that evening of the meeting. So it was pushed off till this meeting. In regard to the violation, an application for a septic installation was made. No fee was paid, and the permit was not issued. And the septic tank was ultimately installed. The engineer and the installer both issued as-built. So at that point, we could see that the work was done, and the Board of Health did not inspect the installation, but the engineer did. So there is a representative here for this property.
Okay. If whoever's here to represent, please state your name, and if you have some detail to add to this, please.
Can you guys hear my audio okay?
Yep.
Okay, great. So I'm Mika. I run the company with my husband, Michael. He is busy with the 4 kids tonight, or I'd harass him here. But so what happened was I applied online for the permit, which I've done before. We've done septics in Mashpee before through Habitat for Humanity and had no issues. And I spoke with a woman at the Board of Health, and she'd said, oh, BSS, the engineer, should log on and do their part. They should upload their stamped plans and do their, tank calculations and whatnot. And then, you'll get an email when it's ready. And I was like, great. So I called it's a Jeff over at BSS, who we haven't worked with before, but the builder, I guess, does a lot of work with this BSS firm, and they're obviously licensed in Mashpee. So I called Jeff and I said, you just need to log into your Permit Eyes and upload your plans and, do all your calculations and stuff. And then they'll sign off on the permit. And he was like, I don't, one of the girls up front will do that. And I was like, all right, great. Well, whenever it gets done, we need it to get going. So I never got an email. So I'm aware that no permit was issued, but the guys were on site just doing work with their machines. And Jeff from BSS showed up with a card with a permit number on it and presented it to the guy in the excavator and said, yep, no problem. Here's your permit number. Here's your as-built card. The operator literally said, should I call the Board of Health myself to do the inspection? He said, nope, we can do it ourselves. So as much as I now know I should not, I'm going to tell the excavators, don't trust the engineers. We obviously hadn't had a problem before. This is the first time this has ever happened. But when an engineer walks on site and you have an excavator operator, they always defer to the engineer. You almost always assume the engineer knows, especially when we say, should we call the town for an inspection? And he says, nope, we can do it ourselves. We were told this guy did a ton of work. So I feel really bad. I mean, obviously it's a screw up on our part because we trusted some guy that came and gave us a permit number. It turns out he used the application number as a permit number and put it in the permit number spot and handed it to the guys on site. So it was just one of those kind of clusters that ended up not falling in anyone's favor.
Okay. Glenn, have you spoken with anyone at BSS?
Yeah, they didn't give a whole lot of information though.
Okay.
Didn't have a real good response to that, so.
Yeah, I tried to contact them several times. Jeff And then they have I think his name is Bob or something. He was like, I'm having a hard time getting a hold of Jeff. I have sporadic communication with Glenn. We haven't really heard back. And I was like, well, I'm confused. You guys told us you had a permit that like you printed it out and gave us a number. Where did that come from? And they just stopped emailing and calling back.
Okay.
So I mean, I obviously have to apologize for the guy on site. He shouldn't trust, obviously now we know, don't trust that engineer with anything, but almost
Right.
all operators follow what any engineer says. So if someone walks on site with an engineer's license and says, I can do it, and he's worked in Mashpee before, you're like, oh, he must know more than I do.
Okay. All right. All right. Ernie, do you have any questions?
I just find it interesting at this point. I don't have any questions.
Okay. All right, so obviously there was some sort of a violation of, the installation of the tank, but I think there are some extenuating circumstances sort of at play here. So, I mean, I think we have, I guess our options, Glenn, typically would be we could issue a warning or a fine in this particular case.
Yeah,
Okay.
we haven't had any other issues with this installer, so at this point, I would say just a warning at this, for this time.
Okay. I think I'd be amenable to that if you would be, Ernie.
Well, I'll tell you what, it'd be conditional for me.
Mm-hmm.
Yeah, you're gonna get a warning, but you're not gonna get another one. Period.
Yeah.
That's my opinion. And
Yeah.
I do not like at all this type of a situation. And I don't like to see it come back again. When you
Mhm.
get a warning, that's it. That's your warning, period. You're in a second, you're in a third. There's no 3 strikes out. There's one, and that's it with me. That's my opinion.
Yeah. Yeah. Well, we could put a condition that, as we've done in the past with certain types of violations, where if there's another violation within a certain period of time, then, this one is back on the board, as a potential source for fines or something like that. We've done that sort of a setup in the past that, adds a little bit of extra incentive not to come back to us.
Which I'm fine with as well. Like, we've obviously done work in Mashpee before. I've worked for the DPW for years. We do a bunch of paving. We've done habitat work. I have zero issue. This was one of those like stupid, we were not the excavator on the project. We were brought in last minute by the builder because his excavator couldn't get to it. We hadn't worked with the engineer before. It was kind of one of those like, we showed up to do some site work and this guy shows up with an engineer's license and a permit number. So the guy was like, oh, must know what he's doing. We walked into a job that was already ongoing to like help somebody out. And it turned out blowing up in my face. But I have no problem with any condition you want to put on it.
Okay.
Well, just as far as if you're going to attach a monetary fine to come back later, it's just that we haven't done that before for the first septic violation. It's just been a warning only. I think it's fine if you want to say you get one warning and that's it. But just for consistency's sake, I don't think any other monetary fine should be attached as a condition, because we haven't done that before.
Okay. Thank you for that, Glenn. I wasn't
I'm
sure
good
what
with
our.
that.
Yeah.
I'm okay with
Okay.
that.
Yeah, me too. Okay.
So
Would you
I
like to
still
make a
just
motion?
need you guys to update, just update Permitize at some point so I can just pay that permit fee as well. Because that still was waiting on this meeting.
It is, yeah, and
Yeah.
we'll do that, and then you'll get an email that'll allow you to pay for the permit.
Okay, good. And you guys got the as-built and everything else. So I think other than the permit fee, you guys are good on my
Yeah.
end.
Yep,
Yeah.
that's correct. The fee, then we'll issue the permit and issue the compliance.
Okay, perfect. Sounds good. Well, then I look forward to it. Thank you guys so much.
Thank you, thank you. Okay, Ernie, would you like to make that motion?
Yeah, I'll make the motion that we go forward with a motion with a warning. Is that correct, Glenn?
Yep.
Regarding this issue.
Okay. And did you want to put a condition on that as well?
Well, as I said, I really, do not like a three-strike method. I like a one-strike method. I'll hold back on that at this time, but it's a warning. I'll leave it at that.
Okay. Okay. Okay, that's fair. I will second that motion. All those in favor?
Aye.
Aye. Very good. Thank you for coming
Thank you,
tonight.
Mika. You're all set.
Okay, great. Thanks, guys. Have a good night.
You too.
Thank you. Let's see. Item number 4, which is a review of tobacco violations for Commons Convenience 414 Nathan Ellis Highway. Glenn, I think you had some information for this for us this morning or this evening. Sorry.
Yeah, I had put together the order letter, but I've not had time to put together a lot of the supporting information. I'd like to have a little more time to do that. And also, Bob Collette is on vacation, and I would prefer that Bob be present because he kind of had firsthand knowledge of the violations, both the past violations and the existing one that is obviously that we used for our violation, but will be in question. So I'd prefer to have him present to answer that directly. There was a fair bit of information because of the history to this, and it's a little convoluted, which I'm still putting together. So I'd prefer to have a little more time to do that.
Okay. Okay. I think that makes sense. It's always best. Particularly, I think in
the applicant and Attorney Wall is present, so didn't know if you wanted to have them address, but that's my request at this point.
Okay. I mean, to me, I think it would be better to have particularly Bob Collette present as he did the inspection, and for the reasons that you just stated. So I think, to me, I think a continuance would be in order for this case.
Yeah, I'd have to
Given the
agree with that.
Yeah. Just want to make sure we have all our information before we even take a look at it.
I did speak with Attorney Wall today and told him that I was getting stuff together, but the way that the day went, I just wasn't able to get to all that. And I did want to prepare that and send that along to him as well, so he knew what our background was and what we were using for our supporting information. So, which I've done in the past and would like to continue to do. So.
Okay. Okay. I think that makes sense. I think that makes sense. Okay.
Next hearing, sir?
That would be January 21st.
January 21st?
Yes.
Okay.
Yep, that's the next schedule. Okay. Ernie, would you like to make the motion?
Yeah, I'm like to make the motion that we continue this hearing to January 21st.
Okay, I will second that motion. All those in favor?
Aye.
Aye. Okay, thanks. Thank you for coming tonight, guys. We'll discuss it next time. Thank you so much.
Okay, thank you very much.
Yep.
Thank you.
Happy New Year.
Happy New Year.
Thank you.
Okay.
Just
Let's
before-
see, now item number 5, review and approve of a nitrogen aggregation plan for 12 Lee Shore Drive. But if you could give us the background information for this one, please.
Sure. Pete, you on there?
I'm here, yep.
Okay.
You want me to give you the, okay, yeah, my name is Pete McEntee with Engineering Works. I'm representing Brian Ranger, the prospective buyer of the property. We are proposing facility aggregation credit area from an open space lot behind the locus, and the design is for a 3-bedroom house. The existing lot is 14,452 square feet, and the area that we have been allowed to use, the association has approved, is the area you should have on the plan there. That's 16,120 square feet. That brings it over the 30,000 requirement.
Okay. Looks,
I've received the plans and the draft grant of easement documents for the credit land and facility land, and took a look at those. And the septic plan has also been submitted with this application. So the board, if satisfied with the design plan, can approve the septic plan along with the nitrogen aggregation plan. I do just have a couple of comments on the design plan.
Okay.
Just that the design plan needs a reserve area, Pete. I didn't see one on there.
Gotcha. Yeah.
And then because it's new construction, the land surveyor should stamp both the survey plans for the nitrogen aggregation and also the septic plan.
Yeah, definitely. Yep.
So those are the only comments I had on the septic and the aggregation documents.
okay. Yeah, the plans themselves look pretty straightforward, and all the calculations are, there's the easement.
Seabrook Village has offered several of these credit land areas as from their open space to increase bedrooms on the vacant lots that are left in zone 2 in that subdivision.
Oh, okay. Oh, okay, there's the calculator. Okay. I was just looking for the calculation sheet.
Good.
Okay. Yeah, it looks like everything's in order.
Okay.
Okay. I think it's good to go.
I agree.
Okay, Ernie, would you like to make a motion for that one?
I'd like to just, might need a little help with the language here, Glenn.
Yeah, Kid, do you have my comments?
Every time I bring them up here, it's been a little difficult to, I have your comments and I
All right.
have,
In my recommendations, I have the list of items that need to be done.
sorry, Glenn. Can't locate it.
I don't see the comments for this one, actually. I see 73 levels, 545 to 2 it, and
I'm sorry, I may not have, I did this one last, I may not have sent it to you. Oh, shoot. All right. Well, the aggregation plan and the restriction and easement documents must be finalized and recorded at the Registry of Deeds with an executed stamped copy provided to the Board of Health prior to the issuance of the septic installation permit and approval of the building permit. The survey plans of the credit land and the septic design plan must be stamped by a registered land surveyor prior to recording. So,
You can put that in a form of a motion. Is that
Okay, yeah,
okay with you,
I
Brian?
think, yeah, that's okay with me. I will second that motion. All those in favor?
Aye.
Aye. Very good.
Okay, thank you. Have a good evening.
All set, you
Thank
two?
you.
Have a good one.
Thank you.
Okay, bye-bye.
Okay, we keep just cranking along here. I want to go to item number 3 on review under old business now, because I think we might have somebody waiting for that particular item here, which is a review of compliance for 545 Katuitt Road.
Yeah,
And if you could bring us up to date on that one.
Yep. All right, sir, are you here for 545 Katuitt Road? Sir, user 1,
Yep, I see someone listed as user 1.
Okay, I'm from Lovell's Lane.
73 Lovell's Lane.
Yes.
73 levels. Let's see. Oh, I don't see that one on.
Yeah, Brian, we need to add that to the agenda because I think we had, shoot. I think we had that continued from the last meeting.
Oh, okay, yeah.
And I didn't put it on the agenda, but I think we need to cover that. So, is it okay if we add that to the agenda?
Yeah, I think so. Then why don't we do that? Rather than review of compliance for 545 Katuitt Road. I would entertain a
545
motion.
Katuitt Road requested a continuance anyway, so I
Oh,
think
okay.
we can, let's do 73 levels first.
All right. Well, since I opened 545 Katuitt, why don't we just handle the
Okay.
continuance on that one?
Okay,
So I'll entertain a motion for a continuance of 545 Katuitt Road.
So moved. I
I'll
second
second
that.
that. All those in favor?
Aye.
Aye. Okay.
all right, thank you.
And now I will ask for a motion to add 73 Levels Lane to the agenda.
Make a motion that we add 73 Lovell's Lane to the agenda.
Okay, I'll second that motion. All those in favor?
Aye.
Aye. Okay. Glenn, if you could give us the update on this one, please.
Sure. Okay, at the last meeting, December 17th of 2020, the board voted to have a letter sent regarding removal of the vehicles and to schedule an inspection of the property and the dwelling. The letter was sent and the inspection was performed yesterday on January 6th. David Whedon, Patricia Whedon's son, was at the property and accompanied the assistant agent and I around the property. The sanitary code inspection form was completed, which documented 5 campers, 2 storage units, 8 vehicles, metal, plastic appliances, bicycles, trailers, and refuse. And I estimated about 20% of the property is covered by debris. Much of it is recyclable, but it's been there for many years and is considered harborage for pests. We did see a shed behind the dwelling that was also observed as collapsed. The on-site dwelling was inspected from the exterior. Mr. Whedon explained that the propane delivery company would not deliver gas as access to the propane storage tank was considered a hazard. There's no heat in the dwelling. The condition of the dwelling was poor and had not been lived in for over 10 years. I think that's probably more like 20, but each room had clutter. We just looked through the windows and saw that each room had clutter on a hoarding scale of about 5 to 6, where there was only a small passageway in each room. The northern section of the dwelling had a collapsing roof, interior walls and ceilings. As far as enforcement goes, $50 fines started accruing back on August 17th, and about $750 had accrued back when we met on the September 3rd meeting. On November 5th, prior to that meeting on that day, the Board of Health staff witnessed the property being occupied and some materials had been removed. I did have a conversation with one of the owners, Ron Turner, yesterday, and he said that the vehicles that his brother Buzzy Turner had, he holds the titles to the cars and won't release them. So he wants to get rid of the cars, but he can't because he doesn't have the titles. So there's a legal question if the owner can remove the vehicles from the property without the titles. And I told Mr. Turner that he'd have to seek counsel on his own on that. I couldn't help him with that. And per Mr. Whedon, the occupants of the on-site trailer have moved to Wareham and are not occupying the trailer. So we didn't have to get into doing an inspection or doing anything about habitation of the trailer on a temporary basis.
Okay. Is the trailer still on site though?
The trailer is still on site, yes.
Okay. Okay. Well, that's a little bit of progress there. Is there anybody here who would like to speak on this issue tonight? If you would, please feel free to unmute yourself and state your name for the record, please.
Okay, Ron Turner.
Hi, Ron. Is there anything you'd like to add to the discussion?
Well, no, I talk to my brother just about every day, and he really sounds like he's coming around as far as removing the cars.
Mm-hmm.
And I talked to him today, and he sounded really positive about moving the cars, and that's all I can say about that. So.
Okay. Okay. Can I ask how long the cars have been sitting there?
Well, different cars, different times. I'm not really good on giving you dates because I never lived here. I lived in North Carolina, and I just moved here 3 years ago. And I know the cars have been there, I'm guessing, maybe 8 years, 10 years, something like that, maybe.
Yeah. I wonder if at this point they're considered abandoned property because they're not. It might make just a suggestion that might be an avenue for you to, if you can't have him remove them. There are abandoned property laws that you can use as a recourse. So it sounds like we have, we have a dwelling on site that is in a severe state of disrepair. There's no heat, so I think at this point it should probably be condemned until it's addressed. And then there is the issue of the cleanup of the other items on the site. So do you have a plan for removing the other items, or?
Well, when I first looked into it, I dealt first with the cars and the vehicles. And then I'm gonna have to look into actually moving the debris. He said he was gonna move the debris. And that's what he's been telling me all along. Each time I talk with him, he said he's gonna move the debris. He said he was gonna do it himself. He said, I have a plan. He told me today he has a plan. I just got off the phone with him a couple of hours ago, and he said he has a plan to move the debris and move the cars off. And that's what I get each time I talk with him. So every time I talk with him, so I can only go along with what he tells me.
Right.
Because like I said, I can't move the cars. I did call a place in, I guess, I don't know where it was. And he told me that I can't move the cars without the title. So
Okay.
my hands are really tired when it comes to the cars. Now the debris, he said he has a plan to move the debris too, so.
Okay. Ernie, do you have any questions you'd like to ask?
No, as I stated when I came on the board a few months ago, you know, it's kind of something different for me to approach because of the past years that, you know, I was unaware of what was going on exactly, or not to use that, but to understand the situation better. As times go on now, and I've seen this revisited a few times now, it seems as though there needs to be, you know, some type of a decision made and executed. Cars can be taken away, I believe, today by donations and giving tax credits. And I understand that correctly, even if they're in miserable shape. Been aware of that in some situations. I don't know if these particular cars would be, but there is an avenue for that I've you know, known to people that have used in the past. So that's maybe something that should be, I guess, listened to for suggestion. As far as debris, well, that, you know, that's really comes to a point where that also has to be removed. So, I mean, what do I say? It's been an issue for a while. Like I said, I came into it in this very last few meetings, and it's difficult for me to find any other reason other than what the board has been going through all of these years. That it's got to come to a point where, you know, things have got to be taken care of.
Right.
As
Yeah, I'm
far
in
as,
agreement.
as far as the car donation, we have donated cars before, and you do still need the title even to donate it. So you still have to have the paper chase on that.
Well, and that answers what that. I mean,
Yeah.
that answers
And
that question.
I did give the information to David Whedon, and also on the letter, I put a sticky to a salvage company that actually pays money for the vehicles, because we've done that also, where that you might get some cash for the money for the vehicles, but you need to talk to them directly to do that. So, but again, you will probably need the title to transfer them.
And well, I imagine you would from what you've indicated.
Yeah.
Right. So I think if we, I mean, I think we really need to set a date for getting this straightened out. I mean, at some point, we do have the ability to take the initiative and clean the property and place a lien if need be, which I'm sure is something that you'd probably like to avoid happening. So, you know, I think we should be setting a date for final completion of this cleanup. It sounds like, you know, this house is in pretty rough shape, and it's probably harborage for rodents itself at this point, if it's partially collapsed. And I mean, it sounds like, you know, there's a lot of clutter inside, and
Well,
there was no. Oh, go ahead.
Per the sanitary code, they have a year for the dwelling.
Okay,
If the town were to step in, it's a year after condemnation where the town could step in and have it torn down. But they have a year essentially to decide what to do with that. Um, uh, what you're saying is correct, and but we didn't. Once the house is secured, we did see an open vent, open gable vent. So, but once the house is secured, that can be covered up, and the other broken windows, etc., can be covered and boarded up. And then the owners would essentially have a year once that hazard is taken away with animals getting into the house. So that the house can be secured for that, and then they have that year to decide. If the boards are taken off and animals are getting in, then the board can step back in and issue additional violations at that time.
okay. All right, so, I mean, I think obviously the building needs to be condemned at this point, and I think we should be setting a timeline for final cleanup on this. So, I mean, what do you think, Ernie, would be a fair period of time for this to be addressed, given I mean, I kind of see it as they're separate but related issues, one being the vehicles, which definitely comes with some legal issues. And then the other debris, which is, I think, less of an issue to be removed. That's a matter of, hiring a dumpster and having it removed if need be. So, I mean, what is your feeling on a fair timeline for those?
Are we looking at 3 timelines? One for the vehicles, one for the debris, and one for the structure? Or are we looking at one timeline? I just don't understand that yet.
Well, the structure for the dwelling is set by the code unless there's another imminent hazard that occurs. So if the dwelling is considered unfit for human habitation and then is condemned, that will meet the requirements of the sanitary code. And then after that happens, and in order to have the dwelling vacated, but in this case it's already vacant, and then secured, and then the sanitary code has a 1-year time frame for the board to step in if nothing happens with the dwelling at that point. The time frame is really up to you for the vehicles and for the cleanup of the property. If you want to set it as one date, that's up to you. If you want to set it as 2, that's up to you.
What do you think, Brian?
Well, one date is certainly easier. I think the vehicles are going to take more time, and I don't want the cleanup of the other stuff on the property to be held up because of that. Sort of as an aside. So, I think if we set a set a 90-day time frame on this, which should provide adequate time to pursue, some sort of legal action with the vehicles, and certainly adequate time to address the refuse. Or we could go with a shorter time frame.
No, I think the 90 days. I'd agree with on the your comments on the vehicles and the debris, and that would leave the home or the structure 1 year, right, Glenn?
Yes.
Yeah.
I think
So
the only thing I
Yeah.
want to add to that is because we're in the winter months. And who knows, we could get one of them stupid freaky storms. And all of a sudden, we're sitting on 3 feet of snow. I guess I'd have to call them snow days, which could be added on to the 90 days. But it's a possibility. That's why I want to bring it up. I mean,
Yep.
it could be, inaccessible area because of a bad storm being in this
Yep.
time of year. I mean, it could be in any time of the year. It could be a hurricane or whatever. But right now, you may be looking at a severe snowstorm that we
Yep.
haven't gotten in a long time, but we might. So I'd have to say weather, how would you say it?
Weather dependent.
Weather dependent?
Yeah.
Yeah.
Yeah. And I think that makes sense. I mean, we could set a 90-day time frame and then review it at 90 days. I think, this board in the past has, given some leeway when progress has been demonstrated at those points. So if we got to the 90-day point and it seemed like, there were some extenuating circumstances, perhaps at that point we could, extend that deadline based on those circumstances. But I hesitate to sort of automatically give a longer time frame just because we don't want it to sit for too long. So I think that 90-day check-in, at a minimum, a 90-day check-in is, a good starting point. And then, like I said, taking a look at it again at that point to see either we have final cleanup or there are, remaining issues that would preclude that from occurring. And then, if at 90 days, there's no movement and there's no good excuse for it, then, at that point, we could take further action as a board.
I would support that in the form of a motion. Exactly what you said, Brian.
Okay. Well, then I will second that motion. All those in favor?
Aye.
Aye. Okay. So then we also need to address condemnation of the property. So I would ask for a motion to condemn the property at 73 Lovell's Lane based on evidence found during an inspection of the dwelling by the health agent, which indicated numerous sanitary code violations, which would deem the property to be uninhabitable, I'm sorry.
I would make that motion.
Okay. I'll second that motion. All those in favor?
Aye.
Aye. Okay. Very good. Thank you for coming tonight, Ron. I think we've got some timeline set, and let's get this moving and cleaned up, and
Okay, thank you.
thank you so much.
Thank you.
Thank you.
Thank you.
Okay,
Good night.
Good
all
night.
right, no. Good night.
All right.
Um, The owner of 545 Katuitt Road popped in for a minute, to Tanya. I don't know if she's still on. But we had already continued that hearing for that property. So I think she has dropped off.
Okay.
But I'm not 100% sure.
All right. Well, if she reappears, perhaps we could reopen that. Otherwise, we'll just, I guess, continue on.
Okay.
Hello. This is Peter
Pete?
McEntee. Yes,
Hi, Pete.
when I got to the meeting, I had received a call from Titania. I had no idea of anything being on the agenda or if I was even needed, but as a courtesy to her, I just ended up, coming back in on the meeting. I gave her the information to log on to the meeting, but this apparently she did, but
Okay.
it dropped off. So I guess
She had
if
asked,
I'm needed,
had asked for a continuance, and so we granted her the continuance.
Okay, I'll inform her of that then.
Okay.
Okay?
Well, thank you.
All right.
Thank you for being the middleman, Peter. I appreciate it.
All right, you're welcome. Thank you. Goodbye.
Good night. Okay. All right. So we have our COVID-19 update. We've got, it seems like, some good and some bad in terms of COVID since the last time. Good in that we've got some light at the end of the tunnel with the vaccine, and not so great with the numbers that have been coming in lately. So
Yeah, the numbers have been heavy and steady, unfortunately.
yeah.
But we've been busy here, and Kate, again, is handling the bulk of this as far as the contact tracing or liaison with the VNA, the school, and the CTC, and she's just doing an amazing job. And she has walked into a very tough situation, but she is so sharp and so motivated. I know it is taking a toll on her, as it is with all of us, but she's doing an amazing job. And so the bulk of this is her making policy decisions on certain things, but she is handling and the review of the guidance, and I'm know enough to be dangerous. So she is out for a few days now, where she is in the process of buying her first home. So that's why I'm here, and she is getting ready to do her closing tomorrow. So,
Ooh, that's exciting. That's really exciting. Good for her.
so
Pass along on
if
congratulations.
you want me to read through it, I will. If you have questions, I will answer them the best I can. But we're still getting our share of complaints, but we're also getting lots of questions about from seniors who are looking to see when they're going to get their doses for the COVID-19 vaccine. And we're explaining to them that it's a phased approach. And for those who have emails, we're sending them the email links to the state so they can see just how the state has laid it out. And we're telling them that we're still waiting on information from Department of Public Health, what our participation is going to be. And again, we're planning on having something prepared. I spoke with Scott McGann in Falmouth this morning, and looks like he is going to be using the county and not using the VNA. The VNA is just spread so thin right now, where I think that I'll have it on for the next board meeting agenda to discuss when I get more information, hopefully from the county. But he was looking at doing something regionally, and I think that would be better as an application for us also, rather than trying to do something on an inflated flu clinic type of drive-through, which we could do and which we could ramp up relatively easily. But I think that if we have a set location where Barnstable County and their nurses, and then us supplementing with our own labor, and Community Health Center has offered their help and some of their labor, so we can start to nail that down as we get closer to probably February, when we're going to start the phase 2.
Right. Right.
I,
Oh, that's good.
yeah, I think you can, hope you would understand that I've received a lot of calls, which I should be having a way of answering. Me being the youngest out of all the elders, I'm only 76. But anyway, yeah, I do around town all the time. a frequent visitor to a market and so on and so forth. And of course, I decided to want to get on the Board of Health a few months ago, and that got around pretty quick. And so my generation seems to have found their way to my telephone. And it will be nice at some point where we do have some really good information for the elderly population in our town. That would be great. When we do have
Yeah.
something.
Well, Ernie, if you get calls, you're very welcome to pass them on to us. So, because we're here doing that every day.
I
And
have actually done
yeah, good.
that. I've asked them.
The other thing that the seniors are really asking about really is how they're going to be notified once both the 75 and over and then the 65 and over come up in their phases. And what I came up with, and I confirmed this with the Council on Aging Director today, is that we were going to do reverse 911 calls. Because a lot of the seniors don't use computers, they don't use emails, and putting it in the paper is great, but that's only a one time per week for Mashpee Enterprise. So I think that if we do the reverse 911 calls, we get a higher hit rate with that. But Council on Aging will definitely get notified, and Christ the King and the other religious centers will get notified, so they can notify their contingencies. But the reverse 911 is a great catch-all. So that's what we were going to use.
Yep.
I was surprised by the calls I got from, I have a land phone. Probably all us old people have a land phone. And I was surprised the calls I got, and I could tell they were land phones. They were not 7776 or blah, blah, 77. They were all a 477, at least the main part of them. I knew right away. I said, 477. I know exactly who that is. And bingo, there it was. So that 911 call is big for folks that have land phones. And
Yeah.
of course cell phones, but the land phone is very valuable to elderly people. I think you get into your ways, and you've had things for so long. I mean, I don't want to get rid of my land phone. I want it. And I'm sure there's hundreds of people like me out there. Because it's just something yeah, the cell phones are great, but they're a pain in the neck. But I mean, it's a more comfortable phone call for people like myself.
Mm-hmm.
I like
No,
that.
I think,
really like that 911 call.
yeah. No, that's a great system. It's a good thing to have. I just wanted to ask, because it seems like the list of COVID-19 complaints is longer than typical. Are they like repeat types of issues? Or are they just kind of people seeing the same things that everybody else has seen and calling in?
Yeah.
And what are they?
There's some multiple things going on. I also think because it's the requirements are now stricter, so which includes a lot of the businesses where the businesses have to wear them, like Access Auto. Both the counter person and all the mechanics are supposed to be wearing masks. Even as long as they're working, they're supposed to be wearing them once they're outside of their own private home. So I think that we're getting more complaints because there are stricter guidelines out there. But many of them are repeat, where it's difficult because the repeat businesses are businesses that have people with the medical exemption. And so anytime anybody sees any person without a mask on, we'll get a call, and we have to explain to them that a few of these facilities have one, if not several, of the employees with medical exemptions. and
Right.
and which is harder to follow up and harder to enforce because we can't ask people for any backup to that. So we have to take their word on it, but we also have to let the public know that they have there are people out there with those exemptions, and we can't force them to put masks on. We can't ask them for any data to support their claim. So,
Right.
but a couple of those are restaurants that we heard had more people because of the the decreased capacity when it went to to the 25%. And so we've gone out and reinforced that it's not just up to the seating arrangement. Now you have a time frame of the 90-minute stay, and then you also have the total capacity at the 25%. So a couple of those were capacity issues, which one of which we did observe, and the other one we did not because it occurred over the weekend. But those facilities have been educated. So,
Mm-hmm. Okay. All right. Yeah, that sounds, I mean, I don't have any other real specific questions on this. I mean, it's good that, you know, our first responders are going to get their vaccines there. I mean, I imagine they're pretty soon, within the next week, 2
yeah,
weeks.
Mashpee's being done on Monday. Well, actually, Monday, Tuesday, Wednesday of next week, Sandwich is going to be operating, and they're staggering all of the first responders for the 4 Upper Cape towns. And their Thursday is a swing day. If they have anybody that's left, they can go into Thursday. But Monday, Tuesday, Wednesday of next week are planned in Sandwich.
Well, and I got a question for you. And I'm going by what I see on the news, and I don't know whether that's true or not these days, who knows? But anyway, it seems as though that some of the first responders are not getting the shot for various reasons, and I understand some of the reasons that they're commenting on. But my problem is when I hear there's, and like I say, just going by listening to the news, which you really can't go by anymore. But anyway, if there's 8 or 10 or 15 or 18 shots left, they get discarded. Is that true? Because
I had a discussion with the fire chief about that today, and Chief J.J. Burke is the fire chief in Sandwich, and I did have this exact conversation with Chief Rulo, and told him to make sure that there are standby people if other people don't get it or don't show up, or that there are no other doses wasted. And I did see on the news about that one clinic in Brockton, and it was less than 10 doses, but either way, they should have had people waiting in the wings to not waste any of those doses. And so Chief Rulo and I had the discussion, and he said he would make sure that he has that same discussion with Chief Burke in Sandwich.
that's the exact point I wanted to hear. That's very, to me, that's very good news, okay?
Yep.
Because
Yeah.
you gotta have a plan though, okay? And I'm so glad you've had that discussion. And thank you very much.
Yeah, no, that I totally agree that and I know it may only be 1 or 2 doses, but there's no excuse not to get every dose into an arm, period.
Well, Thank you.
And because Chief Rulo told me how many people were going and how many doses that they had, and there was an excess of about 20 doses. And I said, in no way, shape, or form are those doses to be wasted. And he said that he would make sure he has that discussion with Chief Burke.
Yeah.
Good stuff.
Yep.
Good going, Glenn.
Yeah. Yeah, at least walk over to the Council on Aging, walk them over and find 10, like just get them done.
Give the emergency management a call. He'll be right there.
Right? Yep.
Oh, that's funny.
Yeah, there's no reason. There's enough people out there to drag in to get a shot. So there's no excuse.
Yep.
Good stuff.
All right. Well, thank you for the update on that. I think we only have one item left on our agenda, which is the winter sports program. I mean, I understand from your email that our role in this changed between our last meeting and this evening, and that we have a very minimal role to play, unfortunately. Do you have any sort of additional information to add to this for us, or?
I don't. I just merely went by council's opinion, which seemed to be pretty firm as far as not altering the governor's guidance, where the governor has stated the public health emergency and the guidelines and orders that go with it, and could not be altered at the local level because there were specific guidance set for youth sports program. So council was, I thought, pretty clear about it, and so I didn't pursue it further other than canceling the meeting of the 30th, which seemed inconsequential at that point.
Yeah. It's still troubling to me when you consider that you can't even have more than 25 people in your own home at any one time, or 10 people in a public place. To me, this is like, it's a public place and you have more than 10 people. It's by that definition, it should automatically be disqualified. And Glenn, I had copied you earlier this week. So being I have my son is in school, I receive updates on the number of COVID cases in the schools, and there had been a case of a student on the basketball team. So the entire basketball team was quarantined because of that. So to me, that's exactly what our concern was, is, one student gets it and now we have a whole, quarantine classroom. And they've had issues down in Falmouth with the same thing. So I wish there was more we could do. I mean, the only thing I suppose we could do is, send a letter indicating that we don't support a winter sports program. It would be totally non-binding, but would at least, indicate our opinion on the situation. I don't know if we want to do anything like that. I don't know if it's worth, sort of raising that political issue, but.
Yeah, I'm afraid you hit the nail on the head, political issue. And I hate those, but I mean, I hate to say it, and I know I'm dealing with teachers and superintendents and, all these brilliant people. Hello, common sense. That's all I got to say.
Yeah, I totally agree. It's absurd. It's really, and, in light of the, the numbers continuing to go up, you look at our neighbor state, Rhode Island, which has some of the highest positivity numbers in the entire world right now. globally speaking. You look at the new variant that's coming out of the UK right now that is more virulent than, you know, the existing strain, and they found it in the United States. So to me, I mean, I don't know, it would make more sense to just hunker down and say, sorry kids, no sports this year, but we did it last year. We canceled them last year. Why are we doing it? Well,
I agree with you more.
nothing we can do. So, but all we can do is come on here and go on public record to say that we don't really support it. So, okay. Well, I don't have anything further, I suppose.
Well, I'm good.
Yeah.
I'm all set.
Okay.
I'll
Entertain a motion to adjourn.
make a motion, we adjourn if that's in order, okay?
All right. I will second that motion. All those in favor?
Aye?
Aye. Very good. Thank you so much, guys.
Yeah, thank you,
Thank you.
guys.
Have a great night.
Okay, you too. See ya.
I'll try to see you tomorrow, Glenn.
Okay, very good.
All right. Thanks. Bye.
Bye, good night.
Bye. Bye, guys.